are the custodians of international norms and principles. And this is one major advantage. Unless we use that advantage, we are losing the power of the UN. One way to make sure that we are more focused, we create more synergy, and we use more effectively the technical resource, the expertise and financial resource within the UN is to develop joint programs and work together, a common objective, a common mechanism of delivery the activities, a common management system, and a common reporting mechanism.
WHO is very, very happy about what has been done because it shows that UN can make impact.
In order to achieve the Millennium Development Goals, which is both the UN objective and the government's objective, it's necessary to achieve equitable development in all areas of the country.
It's really good that we try to get all together passionately also.
We are committed to develop this joint program and support government efforts as a one unit.
There is need for a targeted action.
Our vision for the UN is to become a more effective partner for Ethiopia.
We're working as one.
Coordination role is United Nations country team is coordinating, UNDP and UNCD is coordinating it. There is a lot of program with coordination of Ministry of Federal Affairs. There is a program to support, capacity building for the decentralized Warada administration, strengthening in service delivery and all the rest. And all across the country, there are a lot of different sorts of capacity building and technical support, which is going to help a lot in terms of building the government capacity to deliver public service.
There is a new opportunity that needs to be used by all in order to reduce maternal mortality rate, which is the highest, one of the highest in Africa.
Gender issue, again, is critical. Obviously, women are about 50% of the population of the country, and they are seriously disadvantaged in Ethiopia.
When it comes to gender, we have to be very sensitive to local practices. We have to be very sensitive to fully understanding the local realities, because I think that unless you do that, you may create even a sort of negative impact of our interventions. However, working with the national experts that we have, and that is the way that we do it on the ground, and working with the communities, I think they will guide us on what will be the best opportunities for us.
Given the way society is structured in Ethiopia, often women are not always the beneficiary of even services that are provided, like health services. And so it's not enough to simply provide and supply service, but you must also be attentive to what the demand side of that supply. In other words, can women actually access those services? And one of the lessons we are learning is that women have in fact not always been able to access those services, be they health services, and even in terms of education services, we see, yes, we are almost achieving parity with regards to primary education for girls. But then when we look at secondary level enrollments, we don't see that parity. So in other words, there's a drop-off that is occurring. And therefore, that is where the response needs to be.
We're in the process of developing concrete plans that we can jointly support. Partly with technical assistance, partly with money.
Partnership with the government is excellent in Ethiopia because the UN was the first institution to start talking about harmonization and alignment, making sure that the government in general priorities are at the center of the UN intervention and the donors and the partners' intervention.
The challenge is getting all of the work done up front on the joint assessment, the joint planning, the joint implementation modalities, and that really is what is both the beauty as well as the complexity of a joint program.
Well, it's with the UN, we have the expertise, we have the will, we are committed, and at the moment, I can say, frankly, that we are ready.